Today, we're pleased to unveil a tool that will guide our decisions and action over the coming month. I'm talking about the 4-level systems of regional alert and intervention that have been developed by our colleagues in the public health group. Dr. Lidvac and Dr. Ahuda, thank you for all the work that have been done in the last month for that. The 4-level regional alert system will guide the measure that we take. The system include, and you've seen the slide, a green level for vigilance, a yellow levels for an early warning, orange, which is a moderate alert, and unfortunately, we don't want to go there, but the red level, maximum alert. Now then, a number of different indicators that will allow us to follow the evolution of the epidemic and decide whether or not we want to change, and we have to change the levels that are warranted. The criteria are based on the following 3 criteria. The epidemiological, that's a tough word for me in English, even in French. The control of transmission, the second criteria, and the capacity of healthcare system. We need criteria to enable us to monitor conditions and as they arise and improve how we recognize the trend. Those levels will be reviewed each week by public health authorities, and those levels will be discussed with our municipal level. So mayors and MRC will be aware of what's happening and how they can have visibility, traceability, and action that can be taken at the municipality level, which is very important. All changes will be made public, as clear as we observe outbreak in all Quebec region. That's important to say. We are observing an increase in public eclosion, as we call it in French. So, I repeat, health instructions need to be followed. Each and every one can make a big, big difference in containing the virus. We are all responsible for our acts.
Can you please explain how a system like this would work in a place like Montreal, where the situation in one spot or one borough might be completely different from another?
If I need help, I think that I had a question earlier, do we have a full region approach or a sub-region approach? I think we're gonna go for both. To start with, like Montreal is a good news today. Montreal is not in the yellow. Montreal was in the yellow a few weeks ago, and not only the numbers, but all the qualitative factors have been positive in the last few weeks. Now, within Montreal, we also gonna look, and that's what we were discussing with Madame Plante yesterday, how can we have a more targeted approach with certain sub-region so that we can be, and I've said that many times, ahead of the parade. And this is the reason why we have this system here, is to say, Madame Drouin of Public Health in Montreal will be discussing with the team, with all the teams surrounding Montreal, to make sure that we looked at it with a more targeted approach. So I think it has worked. I think we will need to have those discussions to make sure that we look at region, but sub-region as well.
Is there a worry that if the current trend continues, we're going to need the orange and the red alerts for some regions in the coming months?
I hope not. That's exactly what we're trying to prevent. Thank you for asking that question. That's exactly the reason we're here today, to explain that it is possible that we could go there, especially in certain region, but I think we can look at the positive side of it and saying that if people, because we understand, we gave example even at M&A that, we can contract the virus. So, but I'm just saying, if there is one thing that I would like people to retain today, it's in their hand, and we don't want to go there, and this is their responsibility. So we don't want to go to red.